Hi, my name is Emily. I'm going to be your nurse today. Can you tell me your name and date of birth?
Lily Baker, 22-1966.
Okay, and do you know where you are today, Lily?
Hospital.
Hospital. And what is today's date?
April 16th, 2020.
Okay, so what did you come in for today?
I have pain with vomiting.
You have pain and vomiting? Okay, where's that pain at?
Upper stomach.
In your upper stomach? And can you show me exactly where at your stomach hurts? Up top? Okay, so I'm going to go ahead and do a little assessment, mainly focus on your stomach, and then I will kind of talk to you what we're going to do, how we're going to help you with that, okay?
Okay.
Alright, so I'm going to go ahead and have you tilt your head for me. Okay, and the other direction. Okay. No JVD for her. I'm going to go ahead and I'm going to listen to your lung sounds and your heart sounds, okay? Just going to have you take a deep breath when this is on you. Alright, go ahead and lean forward. I'm going to get it back. Alright, go ahead and sit back. So your lung sounds are clear, your heart sounds are normal, they're a little rapid, but they are not skipping or anything like that. So what I'm going to do is I'm going to listen to your stomach, and since you said it was tender, I am going to palpate around and feel, so just let me know if it becomes too hurtful, okay? So your bowel sounds are hypoactive. I'm going to go ahead and push down. I know you said that size tender. Your stomach is flat. It does have some tenderness up in your right corner, like you said, and all the rest of them do feel okay. Are you having any, how often are you vomiting? Quite a bit? Yeah? So when I looked at your chart, it did say that you were vomiting about 300 milliliters of when you vomited last, so that is quite a bit. I'm going to go ahead and feel your upper extremities just because you are vomiting. It can lower make your skin feel a little cool. So her skin is pale. It is cool to touch. Are you having any other pain in your lower extremities or your arms?
No.
No? Okay, so I'm going to have you go ahead and pull on my hands for me and push that up on my hands. Okay, good. She does have a calf refill of less than 3 seconds. I'm going to have you uncross your legs for me. She does not have any edema in her ankles. Go ahead and push down on my hands and push up. Alright, so what we're going to do is I'm just going to talk to you a little bit about what you came in for and how we're going to help you out, okay? Her IV is patent. It is no kinks. It is running at normal saline, 125 milliliters an hour. She has a full area to go to the restroom without any obstacles in her way. She doesn't have a catheter, so that's not hooked up, so she doesn't have to worry about that. The only other thing she has is an IV, so she would just have to take that with her to the bathroom. So when you came in, you were complaining of nausea and severe epigastric pain, which is that upper abdominal pain. And I looked in, and you had said that you've been taking ibuprofen 400 milligrams about 3 to 4 times a day. So, and you've been doing that for the last few months because of your arthritis, correct? Yeah? Okay, so what that means is that is explaining why you're having some of this pain, because when you take too much ibuprofen or NSAIDs, it can cause ulcers in your stomach. And what ulcers are is they build up in your stomach and they can open up and they can start bleeding. And when you have those ulcers, it can cause that pain that you're having in your stomach and some vomiting, and that tenderness that you're feeling in the upper right quadrant. So what I mean when I say coffee ground emesis, which is what you're having, it means that there is coagulated blood in your vomit. So there's blood in there, and it just kind of varies in color depending on how long that it's been in your GI system. So one thing that we can do for you right now to help with that emesis is give you Zofran. So Zofran is given for you to help prevent nausea and vomiting, and that is what you're having, so that's why we're going to give it to you. But you can have some side effects, which would be like dizziness, fatigue, headaches are common with those as well. So what we're going to do is give you 4 milligrams IV every 6 hours per provider's order. So I will help you with some oral care too as well with that, but I will show you how we're going to administer that Zofran, okay? So first thing that I'm going to do when I give you your Zofran, it is going to be in your IV. So I will take the port furthest away from her, and we're going to give you your Zofran that way. I would clean her port for about 15 seconds. I would flush to make sure if it was just a saline lock, and if it wasn't, I would know it's patent because it was running. So if it was, I would flush, and I would go ahead and instill the 4 milligrams of air or the 2 mLs of air into her vial, and then I would flip up and draw up 2 milligrams. I would then again access her port, and I would clean it off, and I would inject the Zofran over 2 to 5 minutes. So I would give 1/10 of a milliliter every 10 seconds and let it rest for 10. After I was finished, I would reflush again at the slow rate because there will still be a medication in her port to completely flush that through, but I would want to again let that go over a period of time and not inject it over. So after your Zofran is given, you will start to feel a little relief in your nausea and vomiting, okay? So some tests that we have done on you is a CBC, an EGD, and the EGD basically it looks at your down all the way down. So to make it easier for you, they look all the way down. And just kind of be able to see all of your esophagus and all the way down into your stomach, okay? So what we found when we did look at that was your blood pressure dropped, and when we looked at your canister for your suction, because we instilled that NG tube, and when we put the NG tube in, what it does is it helps us have access to your stomach and keep away any of that acidity that is in your stomach causing your ulcers to become worse. So with the NG tube, we are able to suction out any type of acid that's in your stomach, or we can put contents into your stomach. And that will help relieve any irritation on your stomach lining. So when we got your CBC back, we saw that your hematocrit was 10 and your hematocrit was 31. So what we did was insert that NG tube. That's why we did that. So with your blood pressure dropping and your canister with a lot of blood, it was a red flag to us. So what we wanted to do was get your EGD stat because we wanted to make sure that we could take a look at everything. And we did find that you had 2 slow bleeding ulcers and 1 arterial bleed, and we did fix all those for you. Right now, we don't have a date for you to go home yet, but we will be talking and figuring out for you there, okay? Do you have any other questions for me?
No.
No? Okay, so what we really want you to do is make sure that you're not taking so much medication to help with your stomach and making sure that you are trying the best of your ability to lower any acid. And if you have these symptoms again, go ahead and come in, okay? All right, I will be back here in a little bit to see if you need any more help, but just go ahead and take a rest for now, okay?